Morning.
Morning.
How are you?
Doing good.
What's new?
Not a whole lot.
Did you get my message about Bill's birthday?
Yes, Saturday.
Yeah, you can come.
Yeah, I should be able to. I'm getting back. I'm in New York. I leave tomorrow and then I get back Friday evening, so it's Saturday.
Yeah, Saturday night. Okay, great.
Cool. How's your class?
I had a discussion with the person that whatever hired me yesterday because it's like, is there anything I can do to change your mind about quitting?
Yeah.
I was like, nope.
I don't blame you. I mean, it's.
Yeah, I told her I'd finish out the semester, but she said she suggested that I record to the cloud because part of it might be the computer as far as so being able to upload the lectures. So I'm gonna try that today. And then she said she would take it from there because we've had so much problem. But she said I can do the quizzes for you. I can. She said I can try to do all the computer stuff. I'm like, no, I said basically I said you know, I need a better return on. I said there's only so many hours in the day. I need a better return on my time than what this is supporting me. So.
Yeah, I don't blame you at all. You probably make 5 times as much doing your vet stuff as you do.
I need to ask for a raise there too, actually.
Yeah.
So I'm getting ready to do that because I hadn't had a raise in 10 years because I hadn't asked. Yeah, I know. I'm an idiot. I'm just an idiot. Just say it.
You're obviously not an idiot. You just
I
have idiotic tendencies.
don't speak up for myself probably when I should.
Everything else going good though?
Yeah. But you know, people don't come to you and say, would you like more money?
Yeah, they don't.
Because I know the last time I asked for a raise 10 years ago, he's like, no problem. So I should have done it sooner.
Yeah.
Yeah.
But that one guy owns the whole practice, right?
Yeah. Yeah. Yep, it's his baby.
What time does your class start at?
9. So Nick moved all his stuff out, I see.
Yeah. That was.
Was it ugly?
I mean, I don't. It wasn't ugly, I guess. I don't know. He knew it was coming.
Did you have to sever ties or did he just leave?
He sort of pushed him. The straw was that he didn't have health insurance, and like his grandpa doesn't get health insurance anymore because he's just part-timer. And Nick busted his eardrum and had no way to, do it. So he realized he needed to get a job with health insurance.
Oh, did he get a job?
I don't think so. Yeah. So I don't know what his plan is, but yeah.
Like with the marketplace, you can purchase it, right? So he could purchase it probably.
Yeah. And he could get since his mom died, he could get health insurance until he's like 26 or something.
Wow.
Through Medicaid. Something like that.
Yeah, probably.
But he just hasn't done. He didn't fill out the paperwork for 2018, so he has to wait until the window for 2019.
Yeah.
Whenever that is.
You hear from your brother?
When was he from the last? we saw him this weekend, Sunday for like 30 seconds before he went back to Petersburg to swing by the house. But he most of the weekend.
Is he busy out there or?
Not really. He said that he gets like 4 hours a day, just breakfast, lunch, and dinner, or 5 hours a day, or some ridiculous amount of time, and he only works for like 3.5 to 4 hours a day, doing actual work stuff.
And the other time is his.
Yeah, and he has to do a workout in the morning, and then he works until lunch. Well, he gets like a 2-hour breakfast. Then he works until lunch. Then he gets an hour lunch, and then he works until dinner, and then after dinner is
Wow.
Yeah, so it's not. I don't think it's very stressful.
No, it doesn't sound like it.
He got excited because he paid off his first student loan. So.
Wow.
Yeah. How long do your classes run?
Just the last one is
What at the time? Like, is it?
9 to 10:30.
Okay.
I'll take a break. That's if I stretch it out. I had 38 slides.
Okay.
I gotta make
So what are
them.
we learning about today?
Infectious disease vaccinations in the canine. Vaccines. I got an hour and a half on vaccines.
Wonder what questions you'll get.
No telling, probably. My rabbit has a hairball.
Oh.
I don't know, the classic one, the classic one I got while I was working on Friday. Somebody called and said that they had a mouse trapped on a glue trap.
Yeah.
Did you see that? I posted about it on Facebook. But so they called and they said they wanted, and so I didn't understand, did they want to get it off to save it, or are they trying to find the humane way to kill it? So it turns out they wanted to save it. So I said, okay, so try some cooking oil. And then so playing this through the person that answered the phone, and she said, oh my God, they said they just pulled the arm off. So I wasn't sure what they wanted.
Hello? Yes. Doing good. Okay. So I'm actually out of town until Friday at 8. I'm so sorry, but yeah, it was a spur of the moment thing. I got to head up to New York for a meeting on Thursday. But I'm in town. I'm in town today. All day pretty much. I have an 11 a.m. today, but the first day would be OPT wise. The rest of the week will be out. Yeah, we can. Next week for me, week of 22nd. I'm pretty open. Yeah. Okay. Yeah, and thanks for coordinating all this. I'm sorry that yeah. Yeah, thank you. Yeah, all right. Thank you. Yeah. Oh, jeez. So did they end up killing the mouse?
Good morning. Can everybody hear me? Okay, great. Well, I hope everybody had a good break, and we're going to get started shortly talking about infectious disease in dogs, vaccines particularly. And before we get started, I wanted to address any questions that you might have, including any questions about your projects where you're going to visit an animal site. Looks like somebody's typing that they visited a vet clinic. So as you get your projects done, you can message me and you and I can arrange together. Obviously, with as many of you as there are, we're not going to have everybody present on the same class. So I think what will work best is if, as you have your project done, we'll try to include 1 or 2 presentations or more as we need to get everybody scheduled before the end of the semester. So if you happen to get your project done early and are ready to present, just let me know. Okay, Aria has a question. Go ahead, Aria.
So I was just wondering, like, what the project itself is about. Like, are we writing something about the, like, what we learned or what they do, or like, what are we presenting?
I'm not sure I understood everything you were asking, but there are some guidelines. Did everybody find that page? Could you see that page that gave you the guidelines on your project? Okay, Joy found it. Okay, so there are some guidelines, and that should answer a lot of your questions, but your presentation does not have to take any particular form in terms of, if you want to do PowerPoint, that's fine. I realize not everybody has access to it or knows how, but your project should follow the guidelines that I gave you. So if that doesn't answer your questions, then ask again, or you can message me. Grace is asking about slides for the notes in the quizzes. Your guidelines for a particular quiz will be given. Emily says she can't hear me. Is anybody else having trouble with audio? Okay, Emily, let's see. All right, type into Emily here. Try turning up your volume on your computer. Okay. Anything else before we get started? Okay. I do know that in terms of using your notes, your quiz this week, you're going to actually prepare some homework on some of the diseases that we're talking about today. The homework is going to be just for you, not to turn in, but your preparation notes are what you're going to use for the quiz, and you'll be able to look at them. Week 5 slides. So there are 2 lectures that are not up because of there were some problems uploading. We're going to try something different today. I'm actually recording this lecture to the cloud instead of the computer because I think part of the issue might be my laptop is not the most up to date, and so we're going to see if that works better. If anybody still needs those previous 2 lectures, then I'll see what I can do in terms of maybe giving them to Carrie on a DVD and seeing if she can do something different with them and get them posted. I tried, and my husband tried for over 2 hours, and it would just sit there and grind and not upload. So I apologize for that. I guess if you still need them, let me know. Okay, Emily's still having some difficulty. Hopefully she'll get that sorted out. But if everybody else can hear, then we're going to go on and get started. Oh, Emily can hear us. Wonderful, wonderful. Okay, so everybody's with us. We're going to go on and get started. Okay, so again, we're talking about infectious disease and vaccinations in the canine, and this is particularly associated with dogs, but a lot of the concepts we're going to talk about apply to vaccines in all species, including in people. So I chose the dog just to limit it for time purposes. If we have time this semester, then we can do the same thing and talk about some of our other species. But for today, we're addressing dog vaccines. So the first thing we need to look at is, what are vaccines? When we say that somebody's going to get vaccinated or we're going to give a vaccine, what are we doing? So vaccines prepare the body's immune system to fight off whatever disease that vaccine is for. And vaccines do that by containing antigens which are similar to the disease, but they don't actually cause the disease, but they cause the immune system to recognize the antigen that the vaccines present, and in a fashion that is probably more in depth than what we can get into right now. The body uses that to prevent the disease that we're vaccinating against. So to simplify what is actually happening, when the vaccine is given, the immune system is stimulated mildly, but you may actually recognize this. So I'm sure most of us have been vaccinated against diseases, and you may recall that you go get, let's say, a tetanus vaccine, and your arm is sore. Well, your arm is sore because your body has recognized that vaccine and is already responding to it. Some of those reactions with the immune system cause that soreness. So the fact that you're sore means that the body has recognized that vaccine. So in our example of a dog, if the dog is exposed to the disease that it's vaccinated against, the immune system is already primed, and that gives it a step up to fight off the disease, or in some cases, they may still get the disease, but less severely, because the body has two different immune responses, and one of the immune responses will happen whether it's seen the disease before or not. The other is only initiated by a vaccine or by having had the illness previously. But one misconception is that if you're vaccinated against a particular disease, you're not going to get it, and that's not always 100% true. You may still contract the illness, but just with a better immune response than somebody who has not been vaccinated. So one of the things to think about is that disease is not just about the agent that causes the disease, but a whole lot of disease is about the host. So think about it like, let's say that you've been running around a lot, not getting enough sleep, and then you're exposed to, let's just say, a cold. Okay. Well, your resistance may not be as good as normal, and you're more likely to catch the cold, to get sick, than, let's say, at a time that you've been getting plenty of sleep, you've been eating right, exercising, then you may not contract the cold. So the host resistance is very important, and just as important as whatever it is that you're exposed to. So if your resistance is stronger than how strong what you're exposed to is, no disease will result. For some diseases, you need to be exposed to a lot to get sick. For other diseases, it takes very little. For example, think of a disease like botulism toxin. Just a very tiny amount can kill an adult human or a very large animal. But some things require you be exposed repeatedly or to a whole lot of organism. Other variables include how much resistance, for example, a kitten or a puppy got through the colostrum, which is that first milk, and that's loaded with antibodies. So a puppy born from a dog that was well vaccinated will have a lot of resistance as a newborn puppy because of that acquired immunity. So even before being vaccinated, versus one that was born to a mother who had never been vaccinated. Another example of resistance, a puppy that survives parvo is going to have a very strong immunity from having had that disease. Generally, when you've survived an illness, the immunity that you acquire is much stronger than that we can get through vaccinating. But the downside to that is you have to survive the disease, and some diseases like parvo in a small puppy have a high mortality rate. So we would much prefer not to have to experience the disease because of both the unpleasantness of a lot of these diseases and the chance that the puppy or we may not survive the disease, so to get that immunity. Okay, another concept that you need to understand is called herd immunity. And herd immunity, we use it a lot in veterinary medicine, but the same concept actually applies in humans as well. The concept is that as individuals, we respond differently to vaccines, and some people, for example, people undergoing chemotherapy or somebody who's very sick or immune suppressed in another way may not be able to be vaccinated or may not respond well enough to develop any immunity from a vaccine. So if we get enough people or animals in that immediate community vaccinated, then essentially we have what's called herd immunity. So let's just use the example of, for lack of another example, let's just say flu. If enough people in a community are vaccinated against flu, then there's no one to pass it around. So theoretically, the disease will just die out. Now, that does not tend to happen because vaccine rates are typically, like with the example of flu, are not high enough, and there's always somebody to pass it to that either hasn't had it, has not had that flu virus before, or is not vaccinated, and so the disease continues to pass around and multiply. But this herd immunity does happen and does work, and as a result, some diseases have been eradicated, like polio, for example, in the United States. And for a long time, we really didn't have much measles because the vaccine rate was high enough. I think now with some of the anti-vaccine movement, some diseases are coming back, like we're starting to have more measles outbreaks. There's been whooping cough. So herd immunity exists, but there has to be enough people or animals who are vaccinated. So when we talk about vaccinating animals, we usually have what are called core vaccines, which are the vaccines that everyone gets, and then we have non-core vaccines. So when we look at vaccines, we look at several different factors. So what are you at risk for? What's the animal at risk for? And in the case of diseases like rabies, we look at what diseases are zoonotic, meaning that are a risk of to people too. Because one of the main functions of veterinary medicine is also not just to protect animals, but to protect human health as well. So rabies is one of those diseases that is 99.9% fatal, and we need to prevent all cases. So these are the main core vaccines in dogs, and by that meaning all puppies need these. Any dogs who, let's say, were stray that you're unsure of their vaccine history need these. And in terms of how many doses and so forth, we're going to address that in a minute. But the number of doses is determined by how old the pet is when they start their vaccines. So we have two main types of vaccines: modified live and killed. A modified live vaccine has been modified so that it won't cause disease, and because it multiplies in the body, then it doesn't have to have anything to make it stronger. That's called an adjuvant. With the other type of vaccine, it needs this adjuvant to induce a stronger immune response, but modified live does that on its own, and it generally leads to a good immunity that lasts longer. Downsides, very, very, very rarely, if something has gone wrong in the process, it could cause the disease that it's trying to prevent. This is something that literally almost never happens, but has been noted to have happened. And also, we don't give these vaccines in pregnancy, just because of the things that we talked about that rarely could cause disease or cause some problem with the puppies. Because dogs are only pregnant for 2 months, this is not a big deal because the dog should have been vaccinated and be well vaccinated going into the pregnancy, so she should already have good immunity. And let's say that she was due for her annual booster sometime during her pregnancy. It's not a big deal to wait a few weeks until after the puppies are born to vaccinate mom again. So we don't use these modified live vaccines during pregnancy. And some vaccines like rabies are never available modified live. And this was probably because of the remote risk of causing disease. The only rabies vaccines are killed, and other vaccines are available killed as well. Rabies is one vaccine that I will do in pregnancy, just because of the importance of the disease, and there are no problems associated with vaccinating a dog with rabies during pregnancy. So if needed, we will do that. Killed vaccines are very stable, and that is an advantage. They don't have to be remixed. The modified live ones typically come in the form of a dry powder and a liquid, we call it a diluent. So you take the liquid, which is usually just saline, mix it with the dry powder and reconstitute the modified live vaccines because they're not stable when they're already mixed. But the killed vaccines are very stable. Another advantage, they're very safe, very unlikely to cause disease. The downside, the immunity is typically not as good. However, the rabies vaccine, though it's killed, does confer a very strong immunity. And so in that sense, immunity with the rabies vaccine is not a problem. I'm going to stop for a minute, and because we've gone through quite a lot, and see if we have questions in chat. Okay. Okay, Ellie, you have a question. Is it safe to ever take in a stray dog? Okay. Can you elaborate on what do you mean by safe? Do you mean like, are you going to bring a disease in to your home? Do you mean like, are you going to bring a disease to a current dog that you have, or safe? Okay, yeah, okay. So the question about taking in a stray dog, I think there are a couple issues here, and one issue is with any stray cat or dog, one important risk to be aware of is rabies. And the reason I start with that is because that's the one that's a risk to you. And it's whenever you have a stray animal, we don't know their rabies status, whether they've ever been vaccinated. So because you guys are not vaccinated, as a veterinarian, I am vaccinated against rabies. And in theory, any animal suffering from rabies who could be infectious should be showing some clinical signs of that, but that is not 100% rule. So whenever dealing with any stray dog or cat, take precautions against being bitten or scratched, because the rabies virus is transmitted in saliva. And I think that's one of the most important precautions when dealing with any stray. As far as diseases that your own dog might be susceptible to from a stray dog, if your dog is fully vaccinated, then you're pretty protected against the bad diseases. So I would worry less about that, and just if you're going to keep the stray, then go on and take it into your veterinarian, get its first set of vaccines. With an unknown history, then you're going to want to give that dog a booster shot in 3 or 4 weeks for the distemper combo vaccine. And if that dog is over 12 weeks old, then typically you only need 2 vaccines, 3 to 4 weeks apart. So you'll go on and give it rabies and a distemper parvo combination vaccine, and then boost the distemper parvo vaccine in 3 or 4 weeks. Now, if it's a puppy, it'll need more vaccines, 3 or 4 weeks apart for several times, and we'll talk about why that is in a couple of minutes. Okay. Okay. Any other questions? Okay. Okay, last week's quiz, Grace, I don't think I specifically said you couldn't use any notes for the quiz, so that'll be fine. What's a combination vaccine, and why do you give them instead of just 2 separate vaccines? So a combination vaccine has more than one antigen, and in the case that we were just talking about, the typical combination vaccine for dogs and cats has several different antigens. And I think they're given that way instead of just two separate vaccines because basically, would you prefer to have more than one shot if you could have a combination and get just as good a response? We, as veterinarians, prefer not to have to give multiple vaccines because most time the owners prefer that you give fewer, and some dogs and some cats are very reactive to vaccines. For the most part, I think we can give a lot of painless or almost painless shots, but if we can minimize the number, it's better. And most of us would prefer to have fewer shots if we're the ones getting vaccinated. So that's why we do combinations when we're able. Now, a reason that we give separate vaccines is so that we can know if something does give a reaction, then we can eliminate, by process of elimination, figure out what that reaction was from. So, for example, rabies starts with an R, so I always give that on the right side, and if a lump comes up, then I know it was from the rabies vaccine. So we do try to give vaccines in different areas, and that's usually fairly consistently done, so that even if another veterinarian gave a vaccine and a lump comes up, then I have a pretty good idea of what that vaccine was. Okay, getting back to our lecture. So here's our question about why do we vaccinate puppies and kittens more than once? So if the dam or the queen had good immunity and the puppy or the kitten got antibodies, then they are providing some partial protection. And you could think of this in terms of a graph. So your puppy or kitten is born and has good antibodies protection from mom. And you can visualize that as a graph, and it'd be going straight down like this. It would start off high, it'd be going down, 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 down. By 12 weeks, if you had your time going across the bottom axis, then by 12 weeks of age, almost 100% of animals are just about gone, all those antibodies from mom. And if you have started vaccinating them around, like, say, 7-8 weeks, then their own immunity is starting to correspondingly go up. So if we, the antibodies from mom keep a full reaction of antibodies produced from the vaccine from being protective until those antibodies from mom are gone. And so if we vaccinate every 2, 3, 4 weeks between 7 or 8 weeks out to the last vaccine around between 12 to 16 weeks, and we usually make sure we give one vaccine at, say, 12 weeks and then one more, then we know that the majority of animals, upwards of 90-some%, will have good immunity from that series of vaccines. If you stop before, like, let's say, if you give a kitten or a puppy, if you give, like, the first vaccine at 8 weeks, and then you give one at 11 weeks, you're going to have some animals that have decent immunity, and you're going to have quite a few that don't. So and some breeds of dogs in particular are not, are not as good antibody producers, so to speak. And so for those particularly, you need to make sure they're vaccinated out to 16 weeks. But I think one misconception is that multiple vaccines are recommended for the veterinarian to make more money or something like that, but it's actually because if you stop too soon, the animal is not protected. So you could just say, well, why not wait until 12 weeks to start? But you've got to remember that those antibodies from mom are rapidly waning, they're wearing off, and if you are not vaccinating in there, there's going to be a window of time that the puppy or the kitten is not protected at all because mom's antibodies aren't high enough to provide immunity, and the own immune system from vaccination is not there. So that puppy or kitten is unprotected should they encounter one of these diseases. So that's why we start the vaccines, and that's why we continue them out to near 16 weeks of age. And at that point, they're good and only get a booster a year later. And they are protected. Did that make sense? And any questions on that? Okay. All right, looks like everybody's with me there. Okay, non-core vaccines. So these are the vaccines that we give if the animal's at risk. Okay. I suppose I should have said with the core vaccines, those are the ones that, like we said, rabies protects people, but the others are considered core because of the risk or also because of the severity of the disease. So like distemper is a very severe disease. Parvo can be very severe and is also very prevalent in the environment. We'll come back to that. These non-core vaccines are diseases that the animal may be at risk for either because of lifestyle or other exposure. So kennel cough, if the dog boards or is groomed or goes to the dog park, or maybe just, sorry about the train, I know it's loud, but a dog that comes into contact with a lot of other dogs is going to be at risk of kennel cough. And a lot of boarding facilities or similar facilities will require this just because it's more of an annoying disease than it is a serious one. If you've had a cough that, you know, just hangs on for like 3-4 weeks at a time, but you don't really get really sick, that is what kennel cough is in dogs. It's just one of those spasming kind of coughs. Sometimes dogs will cough so hard they actually vomit. But they try to lie down at night. They can't get comfortable. Their owners can't get comfortable because they just hear that dog cough, 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 cough. And the cough usually stays in the upper airway, the windpipe, trachea. So it's a upper airway cough as opposed to a lung cough. So they don't get really sick like pneumonia. Lots of times they don't even run a fever. They don't particularly feel bad, but they just can't stop coughing. So for dogs in that at-risk group, we recommend kennel cough vaccine. Lyme disease, you should all be familiar with. It's carried by ticks, and it is a bacteria carried by ticks. A lot of the vaccines are for viral illnesses, but Lyme disease is a bacteria, Borrelia. And in my area, I would say all dogs are at risk because I have diagnosed Lyme disease in your little 2 and 3 pound tiny dogs like poodles that they even pee on pee pads in the house. So somehow they've come in contact with a tick, and ticks are the vector. They carry the Lyme disease. They bite the dog, and that's how the dog contracts it. So in my area, all dogs are really at risk of Lyme disease, whether they are primarily outside or inside dogs. But in some areas, you may consider this not a core vaccine unless they are outside dogs primarily. Leptospirosis is another one of those diseases like rabies that is zoonotic. However, we would not consider it near as serious to people, although it can be very serious and you can die from it. We catch it from pets that have it by contact primarily with their urine. But leptospirosis is another bacterial disease that dogs get from standing water, typically where deer or rodents have gone to the bathroom, or similar animals. Cows can also get lepto. And again, some people feel this is not a core vaccine, but since you do have large rodent populations, even in cities, I think this is one of those diseases that probably most dogs are at risk for. For a long time, we didn't vaccinate tiny dogs for it very often because this is one of those vaccines that if you're going to have a vaccine reaction, meaning like an anaphylaxis type reaction, which is the type reaction if you know somebody that's allergic to bees, that's the type of reaction I'm talking about. So not just like a lump at the vaccine site, but these types of vaccine reactions are rare. We do see them, like, a handful a year, and I vaccinate a lot of pets, but this is one of the antigens that is more reactive, and so for some reason, small dogs seem to be more prone to these types of vaccine reactions, and so we have in the past not vaccinated as many small dogs for this disease, but the disease prevalence may be increasing, so that may be changing because it does seem that we are seeing more cases. And leptospirosis tends to cause severe liver and kidney injury, and it's one of those diseases that can be fatal. Canine influenza is similar to the influenza or flu that we get, and in the practice that I work for, we don't vaccinate for it, and it's one of those things that I personally have not seen any cases of canine flu. I have heard that it has been present in neighboring states, and I guess if it becomes an epidemic type problem, we'll start vaccinating for it, but we do not consider it a core vaccine. I would think that if you travel a lot with your dog, maybe, or if there's an outbreak in your area, then that might be a core vaccine. Okay, so if we're going to talk about some of these diseases individually, rabies is an important one to start with because, like I said, being zoonotic, meaning that we can get it, and because of the risk of it being almost 100% fatal. Rabies is a viral disease, and we catch it from saliva or from handling tissues of the nervous system. And any mammal can get it and give it to another animal. So rabies attacks the nervous system and causes severe neurologic symptoms. It's considered about the deadliest disease on Earth because of the fatality rate. And it's still a huge problem worldwide. I have a veterinarian friend who has devoted her life to living in Haiti, and one of the main things that she is working on is trying to reduce the prevalence of rabies there. So she has lived there for more than 10 years now, I think, and she's working on collecting blood from animals there because they have found some host. Typically what is generally thought of as rabies is by the time that an animal is showing signs, it's just a few days from death. But she has found in Haiti that there are animals that carry the virus, but it doesn't make them sick, or it doesn't make them sick for a long time. So they're actually serving to continue transmitting it, which is very scary because, that is promoting the spread of rabies. So it's a fascinating illness, but not one that you want to see in real life for sure. So again, it's transmitted through the saliva. So you need to generally be bitten or scratched. If you're scratched, or if you have an open wound and you come in contact, with the saliva, you wouldn't have to be bitten. And the key factor is the bite is typically unprovoked, which is not normal animal behavior. Typically these animals are not acting normal. In other words, you can tell that they're sick by their behavior. So which animals carry rabies? Dogs are the main natural reservoir. So this is why the emphasis on vaccinating dogs, also the emphasis on vaccinating cats, even though they're not the main natural reservoir. Cats have also been implicated as being carriers. In fact, a sad and scary story that I think of is one of my classmates from vet school. The practice owned by her parent, who is also a veterinarian. Somebody brought in a small kitten that was a stray kitten, and everybody coming into the veterinary clinic and everybody that worked there all thought, oh, what a cute little kitten, and they were all holding this kitten. Well, a few days later, the kitten started acting funny and walking funny. And I think the first sign in this particular kitten was just a lameness. So you could easily think, oh, it just hurt itself, some kind of orthopedic injury. But it rapidly progressed. And fortunately, this kitten was sent to be tested for rabies. Now, one important thing to know is there is no before death test for rabies. The only way to test for rabies is for the animal to die or be killed, and you have to actually cut the head off, and the brain has to be looked at under the microscope to identify what's called Negri bodies, and that is pathognomonic for rabies being present. And that is still the main test to determine rabies. So somebody thought to test this kitten, and lo and behold, it had rabies. So at that point, the human health department has to be called, and an attempt has to be made to track down every possible person who came into that clinic who might have handled that kitten, because they had to go for post-exposure vaccines, because they were not vaccinated. Anybody that was vaccinated can just get a booster, but if you've not been vaccinated and you might have been exposed to rabies, because it is 100% fatal, that was the only means of dealing with this. So that particular little kitten ended up costing hundreds of thousands of dollars for all these people to be tracked down and to get post-exposure vaccines. So it was a huge thing. Now fortunately, there were no cases of human rabies associated with that exposure, but it just goes to show that we can't always identify every possible instance early on that turns out to be rabies. So we all need to be careful handling unknown animals. So that was a freaky, scary instance, and you can just imagine the public relations nightmare for the veterinary practice, because we're the ones who are supposed to not only take care of animal health, but supposed to take care of human health. And you can think of all the people who had contact. I mean, it was everybody from UPS truck driver to clients of the veterinary practice, children who came in with their parents, and you can just think of that. So it is a lesson, a painful lesson, but fortunately not too painful, in that we were able to prevent disease. So any mammal can carry rabies. Other known natural reservoirs are skunks, raccoons, foxes, coyotes, and bats. And the thing to know about these various species is that some of them may be carrying it and may not appear sick, at least initially. And because of bats in particular, is why when people use the excuse that my cat never goes outside, it doesn't need to be vaccinated for rabies. Well, one of the things to remember is that bats get in our homes, and the Centers for Disease Control recommends that if you wake up and you've been asleep with a bat present in your room, that potentially you could have been bitten by that bat, because their bites are so small and can be painless that you can be bitten and not know it. So like people who have been in caves have contracted rabies without knowingly have been bitten by a bat. So they're thinking that they probably got bitten and didn't know it, or potentially came in contact with bat saliva. So this is why even indoor pets who never go outside still need to be vaccinated, because of the risk to people. Because if you wake up and there was a bat in your room, and because you may have been bitten, the recommendation is that you get the post-exposure treatment in case you were exposed to rabies. So that's how serious the CDC takes rabies. This is an older map, but it just shows the cases of rabies. And so you can see the eastern seaboard has a lot of cases. It looks like right in the middle of the United States, there are a lot of cases. And then for some reason, there aren't many cases, in some states. And I don't know why that is, if they're just missing some of the cases, or why the incidence is so much higher. But it also has to do with the population of the species that commonly carry it, and with the density of people living in contact with those wild animal species. So how do you tell if an animal has rabies? I think the bottom line is you may not always be able to tell. A rabid animal, they may be stumbling around. They may be acting aggressively. You always hear about foaming at the mouth, but that's only when it's pretty advanced, and that's because of the virus affecting the salivary glands. One of the other signs is fear of water, but that is actually also in more advanced cases. I think the bottom line to remember is it may not always look like you think it's going to look like, which is why even experts get fooled sometimes. And this is just a poster reinforcing that yeah, puppies are cute, but you can't always tell if an animal has rabies. So the advice is if you're bitten or if you have somehow come in contact with an animal's saliva with broken skin, eyes, or mouth, wash well with soap and water and call a doctor. This particular poster was geared towards our armed forces because certainly the incidence of rabies is much higher in countries outside the U.S. because of the control that we have worked hard to employ here in the United States. And so we are not nearly at the risk that we would be in another country where you have very few animals that are vaccinated. And that's just reminding them that even kittens can be deadly. So the prevention to rabies is vaccination. And the estimate is that 20 million dogs are culled or killed every year in an attempt to keep rabies at bay. And so they're talking about not in this country, but in other countries, the methods used are usually inhumane, and they include things like poisoning, electrocution, drowning, clubbing, and that's very sad and not very sophisticated. But I guess it's you know, all that they have, and they don't have the humane euthanasia methods available to them that we have, and they don't have the unlimited rabies vaccinations that we have. So it's very sad. What's even sadder is this is said to do nothing to protect people from rabies because new dogs quickly move in, and then you know, they brought in yet more chance of bringing in rabies. So the stray dog populations don't particularly seem to decline. So this brings us back to the idea of herd immunity, so that preventing rabies involves vaccinating the dogs, which becomes the barrier between the disease and wild animals and people. And then once the dogs are vaccinated, as they're trying to do in countries like my friend in Haiti, then the people who have been told to avoid dogs because of the threat of rabies and other diseases, then it provides a better life for the dogs too, because they're perceived better. And then we have not just better for humans, but we have improved animal welfare as a result also. Okay. So vaccination protects. It protects the pet and it protects the people. Okay. So that brings us up to another disease, which is one of the primary diseases in our combination vaccine, and it's known as distemper. And this is probably a good place to take our 5-minute break, and then we'll come back and pick up here with distemper, and I will pick up with any questions that you have. So go on and take your 5-minute break, and we'll come back at 10 o'clock. Okay, so if everybody's back, we're going to get started again, and I'm going to look at a couple questions that we have in chat. From Grace, can dogs have ginger or trail? I don't think I'm not aware of any toxicity, but I don't think you're going to find a dog that's going to particularly like the taste. I would refrain from trying to give them ginger or ginger ale. Question about should you go to the doctor if you're bitten? Absolutely. And if you've been bitten by an animal, then the first thing that the health department is going to, the health department will be involved, and the first thing they're going to do is find out the rabies status of that animal. And if the animal is not vaccinated, then the recommendation would be that the animal can be confined, or depending on the situation, you may be recommended to get the vaccine, the post-exposure vaccine. So the doctor would make that recommendation based on the situation. Okay, so we're talking about distemper now, which is one of their main antigens in the combination vaccine, and this is a serious illness that causes GI, breathing, and potentially central nervous system signs, as well as signs in the eye. The signs of illness include sneezing, coughing, thick mucus, fever, lethargy, vomiting, diarrhea, depression, loss of appetite. And this is one of those diseases that also circulates among wild animals like coyotes, raccoons. A dog that does not have good protection or that is unvaccinated could pick it up from where, being around one of these wild animals or where the wild animal has been. So the virus is passed from dog to dog through direct contact with urine, blood, or saliva, or in the case of a wild animal, sneezing, coughing, sharing food, water bowls, all possible ways for the virus to be passed on. Can be very serious in young animals, and especially tiny puppies who did not get immunity from their mother. Once infected, the puppies are severely weakened, and the virus can travel to the brain, causing seizures, shaking, and trembling as a result of what's known as an encephalitis. And then because the immune system is busy trying to respond to this viral illness, then the dog is also susceptible to secondary infections like pneumonia, and that actually can be what kills the dog. It could either be the virus or it could be the secondary infections. And like many or most viral illnesses, there is no specific treatment in terms of a medication that's antiviral. So the treatment is supportive care. So these are illnesses that we really would much prefer to prevent than to try to treat. So treatment would be things like IV fluids, antibiotics for secondary infections, and some can survive and some actually die from this disease. So this is not something that we see very often, fortunately, due to pretty high vaccine rates. But there are outbreaks, particularly like animal shelters or places where there is a large reservoir among the wildlife population. Then you're going to have more cases in the pet population. This can also cause lasting issues like seizures that may not show up until many years later because of brain damage that occurred as a result of having this as a puppy. Now we'll move on to infectious canine hepatitis, which in the vaccine is actually called adenovirus, and it is another contagious disease of dogs. The signs may vary from slight fever and congestion all the way to a very severe disease with severe depression, severely depleted white blood cells called leukocytes, and problems with coagulation. It also circulates in our wildlife population, and the scary thing about that is those animals can look well, but be carrying the infection and can serve as the agent to transmit it to air pets. Even though the wildlife appear healthy, they're still carrying this disease. And that just tells you about the virus. Again, passed through urine, feces, or saliva. And if a dog is recovered from this, then they're actually, even though they appear recovered, they're still shedding virus for greater than 6 months. That's a long time. So this is, in the picture, is showing you an example of jaundice in that the mucous membrane, so the gums, the inside of the mouth, the whites of the eyes, everything is yellow. This is very severe. Signs can vary from a slight fever all the way to death, with a mortality rate, depending on the study, of around 10 to 30%, and is typically the highest in the very young. That's true of most diseases. And obviously, if they have a secondary infection in addition, then the prognosis is going to be more poor. Okay, and this brings us to another virus that's in our combination vaccine, and this is called parvovirus, also known as parvo. We have a lot of this in the area that I live. We see quite a few cases, and it is highly contagious. And it's another one of those that the dogs can get from the environment without coming directly in contact with a sick pet. And the virus is a very tough one in that, if a household has had a puppy with parvo and that puppy has gone to the bathroom in that yard, then that organism is pretty much there. So years later, we actually see cases come in, and so it's just, it's fairly easy to kill on a hard surface, like if we have a pet that comes in with parvo that has an accident in the cage or the floor. All it takes is a very mild bleach solution, but once it's in the ground, it's just very tough, and it's doesn't seem to be slowed down by freezing or the sun or anything like that. It's just there in the ground and ready to expose a pet that's not protected. And it is life-threatening. It attacks rapidly dividing cells, so that's why the virus affects the GI tract, and it causes a really nasty, bloody, stinky diarrhea and vomiting. It also affects white blood cells, and in young animals, it can damage the heart muscle and lead to lifelong heart problems. So here's just a picture of a couple puppies being treated with IV fluids. And And the symptoms include lethargy, severe vomiting, loss of appetite, bloody, foul-smelling diarrhea, and then typically what causes the death is either dehydration or secondary bacterial infections. And because of the nature of how contagious it is, we do have to keep these affected puppies in isolation. I think this photo is from an animal shelter. So like if we have an affected puppy come in, you know, we have to be careful to like change any smocks or clothing that we have that have been in contact with the affected puppy, and to wash our hands and arms prior to, you know, handling a small puppy that's not yet fully vaccinated. Once an animal is fully vaccinated, like we talked about, at greater than 16 weeks, then they are protected. But during that period, like let's say you have a puppy who's, you know, 10 or 12 weeks old, maybe had 1 or 2 vaccines. If they come in contact with this virus, they can still get sick. And oftentimes they will, you know, have partial immunity and not get real sick, bounce back pretty quick, but you know, they're still not fully protected. I should say we have an easy test for this disease. We do a little fecal swab, and then it's a little plastic snap test. We just mix the swab that's got some feces on it with the supplied, it's got like a little dropper, and we, you know, mix that, and if the puppy is infected with parvo, then this little snap test comes up positive in less than 10 minutes. We can determine whether or not that animal is positive to parvo, because there are other things that can look similar, like just a colitis, which is can be bloody diarrhea and it not be parvo. So the thing to remember is just that this is extremely contagious, and it could travel on you. It may live, you know, in the environment like we talked about. You can also carry it on things like shoes or a bowl or carpet, floors, but it is easily killed with Clorox on surfaces like bowls or floors. You know, if you launder your clothing normally, that also takes care of it. Commonly contracted, you know, from areas where there are many dogs. So when people have puppies that are not fully vaccinated, I always recommend not taking them to play at places like parks or PetSmart or places like that where there may have been a dog that was infected with parvo, because remember that even after they're recovered, they can still be shedding the virus. So the dog may look fully recovered, but still be infectious to a dog who's not protected. So this is just showing an example of biosecurity, and most clinics don't go to that degree. We don't have those disposable shoe covers and gowns and things, you know, to wear all the time, but we just change smocks and launder them. Places like shelters or vet schools, you know, would have more access to this type of thing, and the biosecurity would be higher, and the diarrhea can literally look this bad. So, talking about who is most susceptible, and this is another one of those diseases that can circulate in the wild wildlife, and some breeds are at higher risk, and these breeds also don't, some of these breeds also don't respond as strongly to vaccines, and so it's particularly important to carry their vaccine series out and make sure they get those 2 vaccines at greater than 12 weeks old. So at least 12 and 16 weeks of age, they should be vaccinated with the combination vaccine that includes parvo. So this is an example of, a vaccine schedule of when to vaccinate and how often. So you've got your core and your non-core, and we talked about the initial puppy series, then booster shots at a year, and annually or every 1 to 3 years. Somebody asked in the chat, how long does rabies vaccination last? And all these vaccines have to be tested for their efficacy. So, they actually have a group of animals and they vaccinate them, and then they have to expose them and prove that the vaccine worked, that they either got the disease or they didn't once they were exposed. So for rabies, in my state of Virginia, it's labeled for the initial vaccine. All animals are boosted at 1 year, and then every 3 years, based on the manufacturer. So the commonly used rabies vaccines are good for 3 years after the first 1 year booster. Some states may require annual vaccination still, and that discretion is left to the state. And you also, as a veterinarian, always have to follow whatever the manufacturer of the vaccine has tested and guarantees. Like there are still some 1 year vaccines labeled for cats that are non-adjuvant. And remember, we talked about how adjuvant makes vaccines last longer. But it's also thought to be, it's what causes the part that causes the vaccine to last longer and be more reactive, also causes more reactions, particularly in cats. And so some people prefer to use a non-adjuvanted 1 year rabies vaccine in cats, and that's called PureVax. You would follow the manufacturer's instructions for that, obviously. This is just a reminder that we follow, we look at the risk of the animal to determine how often to administer some of these vaccines, like kennel cough. That's the vaccine is not that good a vaccine. It doesn't last that long. So it may be repeated twice a year for dogs who are at high risk of exposure. Okay, questions? We're not allowed to use notes in the quiz. I will say yes or no. For example, it'll depend on the quiz. The one that you have this week, you may use your notes because there is a homework assignment on the page that you will not turn in, but you're going to write your notes about the diseases that are in the homework assignment, and then you can use those in your quiz, for your quiz. So I will try to announce week to week whether to use notes or not. Let's see, can you share notes with each other? I want you to make your own notes because that's how you learn. Okay, how long do all vaccines last? It will depend on the vaccine, and then it will depend on the individual dog or cat or person. Some people make really good immunity. Some dogs make really good immunity and some don't. So manufacturer recommendations are based on a range that will cover most, but not all. Is distemper fatal? Sometimes. Can a dog get a disease from drinking in a running creek? Sometimes, but that still doesn't mean that, it's not normal behavior for a dog to drink out of a creek. So I would let them drink out of the creek and just keep them vaccinated. Yes, theoretically they could get something, but I don't think it's real likely. Mostly standing water is more risky. Cat has an allergic reaction to rabies vaccines. If a cat has a reaction, then you can talk to your veterinarian. Sometimes we can do things like give a pre-treatment of injectable Benadryl or steroid shot prior to the rabies vaccine, but because of the human health risk, we really need to, keep our animals vaccinated. And a cat or dog that's prone to reactions, I would suggest separating out their vaccines. You don't want to do them closer together than 2 weeks because it's been shown that if you vaccinate closer together than that you'll get a good response to the first vaccine, but not to the second. So you either want to do them on the same day or separate them by greater than 2 weeks. But I would give that cat or dog one vaccine at a time. Like I would give them their combination vaccine and then 3 weeks later or more their rabies vaccine, and consider pre-treatment. And in the case of a cat, I would recommend trying that PureVax vaccine, which may be much less reactive. It's more expensive, so a lot of places, typically don't do it, don't carry it, but that would be an option. PureVax. It's made by Marielle, or at least it was. Sometimes those vaccine companies change names, but I think it's still made by Marielle, and it's spelled PureVax, PureVax, or maybe PureVax. But it's PureVax rabies for cats. Okay. Any other questions before we close today? You've got a quiz this week and your homework that's not to turn in, but that you'll do to have while you take your quiz. I would also like you to read in your textbook, and it goes along with what we talked about today. The page numbers are listed on your learning page. It starts on page 217. It's the chapter 9, preventative health programs, and it's got the vaccine protocols, and it talks about the same things that we talked about, why we vaccinate multiple times, and duration of immunity, and it talks about all the diseases, as well as if you read on, there's a discussion about the different types of vaccine reactions. And Grace says out to page 221, but if you want to read further, it also talks about, some potential vaccine reactions. And since that came up as we were talking, you may want to read that as well. It may answer some questions. Okay. Anything else? Okay, message me if any questions come up. And thank you for your attention. And this video should be posted. Carrie Iverson is going to work on that. We've recorded it to the cloud, so hopefully we'll get this one up shortly. Okay, thank you all. And Grace, yes, that'll be with the slides. Okay, thank you.